Hello, and welcome back to Recharging the Human Battery here on AM 950 Radio. Dr. Sinacropi is out today, so you've got me, Mandi Dickey, nurse practitioner, in today, and I'm going back to my old standby when I'm here by myself. I'm doing the ABCs of concussion again. We haven't done this in a while, so I got to catch us up to speed a little bit. So the last episode we did of this was letter L, so today is letter M, and all of the topics today that we talk about will be M words related to concussion. And again, if you haven't listened to this series previously, why am I doing this? It's because concussion is such a popular thing to have happen to somebody. Numbers that I heard last year when I went to a conference, last year being 2025, was that approximately half of all people walking around have had a concussion at some point. So it's a huge number of people that are affected by concussion. And we don't always go in to get diagnosed with a concussion because sometimes we don't think there's anything that we can do. So if we saw stars, we got our bell rung, we just think, that's what it was and it'll go away. But it doesn't always go away. So that's why I've been doing this series on the ABCs of concussion, taking one letter at a time and talking about the words that can be related to concussion. So if you've had concussions and you have these symptoms that are lasting and you don't know what they are, maybe this explains why you have those symptoms. If you didn't get diagnosed with a concussion and you have these symptoms, maybe look back and say, before these symptoms started, was there anything that might have qualified as a concussion? And again, so what is a concussion? When you hit your head or don't hit your head, it's just it can be the momentum of movement in your brain inside of your skull, and you don't have to lose consciousness. It can happen with sports. The number one reason is falls, and here we are in the middle of fall season in Minnesota. It's not the season of fall. It's not autumn. It's winter. But it's time when people fall and slip. It's icy outside today. So if you didn't walk like a penguin, it's a good chance you might have slipped today. And those slips and falls lead to concussions, whether or not we get diagnosed with them. And we know now that greater than 30% of patients continue to have symptoms well beyond a year after they sustain an injury. So any of these symptoms that I talk about could be related to that old concussion that you thought was really not a big deal, except for the fact that now you have these symptoms. So as we go through today, again, lots of different topics that we'll cover on that letter M, the first one being migraines. So I'll get into that one a little bit before we go into the break, kind of give you a little teaser on that one. I will apologize for the congestion in my voice today because I'm having a little bit of an allergic reaction to something, a new a substance we used in our home, and it didn't sit very well with my respiratory system. So I don't have the crud that's been going around, but I do have the allergy response. So if I sound a little different today, that would be why. So again, first letter in our ABCs of concussion for today is migraine. And migraine is probably one of the most common reasons people come in to get medical attention after a head injury. Headache in general is kind of the big symptom that brings people in. So not necessarily migraine, but a lot of people fall on that term of migraine because it is a very severe headache that you can get. And many people see severe headache and migraine as the same thing. And they're not necessarily always the same thing. So we have talked about headache on the show before with the letter H, I believe, but I'll bring it back again just because it deserves talking about again because it is so common. So migraine is just one type of headache that can occur after a concussion. And people with a history of migraines prior to their concussion tend to have a little bit more of a prolonged recovery. So we tend to consider that one of the risk factors for prolonged recovery with that. They might have worsening or improvement in their migraine headaches following concussion. Mine went away, but some people get worse with it. And the characteristics of that migraine can change after a head injury as well. So we'll get into more of those details on the other side of the break. But the other type of headache is a post-concussion headache. And I just want you to think on that one as we listen to our little tune and the commercial break here before we come back. So again, we're here on Recharging the Human Battery on AM 950 Radio. I'm Mandi Dickey, your co-host for today. again on Recharging the Human Battery on AM 950 radio. Again, Dr. Cinecrope's out today, so you've got me, Mandi Dickey, doing the ABCs of concussion for, my TBI takeover weeks when I come on here. So talking about the letter M today. So we started talking about migraine before we went to the break, and I was talking about how sometimes people will have worsening of their symptoms with their migraines, and sometimes they get better. So me, for example, I've had migraines since I was a teenager. It's a family trait. Gotta love that. But I actually haven't had a migraine since I had my head injury. I've had a different kind of headache, but it doesn't feel at all like the migraines that I had before. Some patients aren't so lucky. They might have had control of their migraines prior to their injury. And I've had some people come into my office that they maybe had 1 or 2 migraines a year prior to their injury because they were that well controlled. And now they've got them almost every day again. And that's one of the things that we talk about is, what are the characteristics? Does it feel like your migraines? Does it not feel like your migraines? And sometimes they'll tell me, yes, it feels like they're migraines. And I'm okay, then we'll call those the migraines. But then there are other types of headaches that don't feel like the migraines, and they feel like very different headaches. I've had a couple patients come in and say, I have 3 distinct types of headaches. I have my migraine, I have this pain on top of my head, and I have this pain that goes around my whole head, and my head just wants to explode. That sensation of that head feeling just wanting to explode, that pressure inside of the head, that's more commonly associated with something called a post-traumatic or post-concussion headache. Very fancy term, I know. But when we have that trauma, we can get that headache afterwards, partly because of the swelling that occurs, partly because of the inflammation in the brain, and then partly because of the release of different neurotransmitters and hormones in the brain that can increase the pain that we have. So the symptoms can look a little bit similar to a migraine. So you have the headache, you can have lead, light sensitivity, sound sensitivity, nausea, and vomiting. Those things can overlap, but it's more the characteristics of the pain that we try to figure out. With a migraine, it's going to be more one side of the head, more of a throbbing sensation. With the post-concussion headache, like I mentioned, it's more of that pressure sensation all around the head, or it could be the front and the back of the head, or right behind the eyes. It's a little bit kind of nitpicky, but it's the characteristics that really set them apart. And then when you try to treat them, if you try an abortive treatment for migraine and it works, it's probably a migraine. If you try that abortive treatment for migraine and it doesn't work, it probably wasn't a migraine. So that kind of helps figure out what kind of headache we're dealing with as well. There was one study that I looked at as I was pulling my notes together for this show that identified that 35% of patients with a TBI continued to have chronic headaches even 5 years after their injury. So that's kind of about as far out as they look to see what's happening with these now chronic headaches after the injury. And we consider something chronic if it's been present for more than 6 months. So we get these chronic headaches that can last for 5 years or more. I've had some patients that they had injuries 10 years ago and they're still sitting here with these headaches that come on. But most often, providers out there are trying to treat these headaches as if they are migraines. They're calling them migraines. They use the migraine treatments. And as I mentioned, the treatments might not work. So the post-traumatic headache actually hasn't been studied as extensively as migraine because it's not seen as common of an issue, but there's a lot of uncertainty in the research because of that lack of research. So we don't know what exactly the best treatment course is. Now, I can tell you from my own experience and from working with my patients and all of the reading that I continue to do on a regular basis, this works kind of like every other thing in medicine. Lifestyle is going to be your number one treatment for it. And lifestyle is always the part that is simple, but it's not easy. And I know we all like that easy button, but there is no easy button when we're talking about lifestyle management. So the things that we need to do to help prevent those headaches are things that we should probably be doing every day anyway. But let's kind of talk through all of those. The first one being drink plenty of water. And I know we kind of talk about this ad nauseum on this show because water is life. We are 80+% water in our body. So we need to drink all of that water. And again, ideally, half your body weight in ounces of water. So take your weight in pounds. We're here in the US, we use pounds. Take your weight in pounds, divide it by 2. That's how many ounces of water you should be drinking in a day. And those 1 liter bottles of water, that's 32 ounces. So if you need to get 100 ounces, you're going to need to drink 3 of those liter bottles in a day. to even come close to what you need on that. So drinking plenty of water, getting adequate sleep. So many of us like to say that, oh, I can work on 4 hours of sleep and I'm just fine. Well, no, you probably shouldn't, because you're having these headaches and you're tired all the time. And no, 4 hours of sleep probably isn't enough for you. Most adults need 7 to 9 hours of sleep. When we get into older adults, it kind of tapers back off a little bit, but most adults need 7 to 9 hours of sleep. And within that, about 25% of that sleep should be REM sleep. So if you don't have some sort of data tracker that you're looking at your sleep, you really should start looking at some of that to make sure that you're getting good quality sleep. Because if you suffer from headaches, whether you've had a brain injury or not, increasing your sleep, improving your sleep is going to be probably the number one thing you can do. And I've talked to some patients, I say, if you do nothing else, I want you to sleep better, because sleep will help so many things in your body. Along with that, drinking plenty of water, getting enough sleep, you need enough protein. So this week they finally came out with the new food pyramid, and they flipped it upside down from what it's been since the 1980s, which I am so excited about because it actually matches up with what I tell my patients on a regular basis. So carbs should be the very smallest thing that you eat all the time, and fruits and vegetables especially, should be the number one up on top, but protein is right up there as well. Protein is incredibly important for so many functions in our body. Can you get too much? Yes. If you have kidney troubles, you have to be careful. But if you don't have any kidney troubles, then keep working on that protein. There are many, many calculators online. So if you wanted to figure out how many grams of protein you should get in a day, go on to any calculator on the Google search or Bing, whatever search provider you use. Type in protein calculator, and it will figure out, based on your age and your gender and your activity level, how much protein you really need in a day. And it might surprise you how high that number is. And it's not just meat that gives us protein. We do get protein from other sources, but they might not be quite as effective as the meat proteins. So if you're a vegetarian or vegan, I apologize. Most of the proteins are going to be meats on that list, but they really do give you the best robust protein on that. And then regular light exercise. After a concussion, we thought for the longest time that you needed to rest until your symptoms went away, but we now know that symptoms can last for a really long time. So we don't want you resting for a really long time, because the longer you stay out of activity, the harder it's going to be to get back into it. So 24, 48 to 72 hours, up to 72 hours is kind of the max that we really want you to avoid any of those activities that are going to worsen your symptoms. Beyond that, we want you to do some light exercise, because that light exercise will help to prevent those headaches from happening. Don't exercise when you have a headache. That's not advisable. I've tried it before. It's not fun. I've never made it through a workout with a headache, especially a migraine. But if you try doing that light exercise, especially walking, we used to think that you had to get these really intense HIIT workouts, the high intensity things, jumping all over the place and doing all these crazy things, and you had to work out 45 minutes plus a day. And we now know that going for some little walking is actually really good. As long as you're walking fast enough that you get your heart rate up, that's a really, really good form of exercise. So do you need to do those really intense workouts? No. Should you probably add some weights in there? Yes, it's good for our bone structure. But if all you can do is walking, do it, please. And then stress management. I know this one sounds kind of funny, because in the world we're living in, there's so much stress, and we cannot make it go away as much as we would love to. If you watch the news, and I try not to because it is stressful, but if you watch the news any given day, it's probably going to jump your blood pressure by about 10 or 20 points, just because there's so much stress all the time. We have to have outlets for that stress. Stress does not go away. It's not going to just magically be erased overnight. If you say, I've got too much stress, I need to get rid of some of that. Good luck, because most of it comes from your family and friends and your job and your car and your house, all the things that you can't get rid of. So the stress will be there. You have to learn how to manage it. So finding some sort of mindfulness activity that you can do every day to decrease your stress. Breathing is really simple. Breathing gives us life, but breathing also gives us calm and rest. And some people say it sounds kind of woo-woo to say that you need to do some deep breathing and it'll help you, but it truly does, because the The nervous system, when we're talking about like the autonomic nervous system, we've talked about that in the ABCs way back in A. Your autonomic nervous system, that vagus nerve goes all the way down through your from your brain all the way into your stomach area, your bowels. It goes through your diaphragm. When you do deep breathing, it calms that vagus nerve. So you're calming down your autonomic nervous system and de-stressing yourself in the process. Again, is that stress going to go away? No. We have to learn how to manage it and how to cope with it so that it doesn't overtake us and create those headaches that we're trying to get rid of. And then avoiding alcohol. Alcohol is not really on the food pyramid. That's not something that you have to have in your daily diet. Many people shouldn't have it because they can't keep themselves to one. Years ago, they identified that for females, 1 drink a day might be okay. For males, up to 2 drinks a day might be okay. But that some people can't keep themselves to that 1 or 2. And then it's probably best to avoid it altogether. But then we also think a lot of times that alcohol can help us sleep. So we have a glass of alcohol before we go to bed because we'll sleep better. That's actually not the case either. About 2 to 3 hours later, your body starts to go through a different cycle as it's trying to break down the alcohol. And oftentimes people actually wake up, or they then turn into this light sleep stage where they're not getting REM sleep. They're not getting good sleep. So while you think it's helping you fall asleep, it's not helping you get good quality sleep. So there's not a lot of really good benefits. That said, there are some people that have something called an essential tremor. And there have been different research articles to show that 1 glass of red wine a day can help to calm people's tremor. I'm not telling anybody to drink 1 glass of red wine a day, but if you're going to drink wine, the red wine does have some of the health benefits. It's got the antioxidants in it that the white wine doesn't. It's just got the sugar in it. So it's not all bad, but if you can't moderate, then it's time to just avoid it. After a brain injury, however, I would say to avoid it for quite some time, at least until you know how alcohol affects your body. And then you probably aren't going to be drinking as much as you used to. I generally don't even get through 1 drink because my brain does not tolerate it very well. So yeah, it was fun at one time, but now it's not so much fun anymore. So I just don't recommend it. It's not a great idea. And then there are some supplements. So when I meet with people talking about headaches and migraines, when they come through my concussion clinic, the first thing we talk about are non-prescription type of treatments. And I like that because most of those things don't come with as many side effects. Is there the FDA clearance with it? No. You can find some that their labs are FDA cleared and they're cleaner than others. And it's best to do your research and make sure you find a good supplement on that. And there are several really, really good supplement companies out there. But there are some supplements that have been proven beneficial in research time and time again, that they can help to decrease headaches. Some of those are the B vitamins. So vitamin B2, especially riboflavin, that one, oftentimes providers will check a level. And if we come back with a low B2 level, we will recommend a supplement. And sometimes we won't check a level and we'll say, you can try the supplement because it's a B vitamin. They're water soluble. You will pee out the extra. You'll just have some bright yellow pee. And it's really not going to be that detrimental to you if you try to take it without having a lab checked. So sometimes people will do it that way, but riboflavin B2 can be very beneficial. Some people find great benefit just from adding the vitamin B2. Vitamin D is another one that's really, really common. Vitamin D, our only natural source is sunlight. So vitamin D, unlike the B vitamins, vitamin D is a fat-soluble vitamin, which means you have to have a fat at the time that you take it in order to absorb it, which is why they come in those little capsules with the oil, because you're getting that fat while you're getting the vitamin D. That said, we have a lot of foods that are supplemented with vitamin D that you're really not going to absorb them from, like orange juice. Orange juice is vitamin C. It's not a fat-based drink whatsoever. So adding vitamin D to it, it's more of a marketing gimmick than anything else. You're not going to get the vitamin D. But adding that vitamin D supplement in the form of that capsule at bedtime especially, it helps to regulate your circadian rhythm. It can help to decrease those headaches. The other one that's kind of right up there, so my top 2 that I typically recommend is vitamin D and magnesium. Lots of different forms of magnesium. My favorite about 10 years ago developed into this magnesium glycinate because all the different magnesiums have different purposes. Magnesium glycinate does a lot for headaches and sleep and brain health. So the glycinate form is my favorite form. That's the one I tend to recommend to most of my patients. Again, you take it at bedtime. It helps to calm you. It helps to relax you so that you can sleep. And again, we talked about sleep being important for trying to reduce those headaches. You get better sleep, you reduce the headaches. So those are my top two, as well as the B2. Fish oil, great for brains, great for trying to decrease inflammation in the brain. Curcumin or turmeric, yes, it's the same as that cooking spice that we do, that bright yellow cooking spice. So if you cook with that on a regular basis, you're probably golden, like the color of the supplement. But if you're not, then there are daily supplements that you can take of curcumin and turmeric, again, that both decrease the inflammation, which can decrease some of those headaches. CoQ10, nothing specific to the headaches, but again, also a really good one for just general brain health. And then creatine. Creatine's been the newest one I've jumped on the bandwagon with. A few months ago, I learned about it, and I may have mentioned it on a previous show. I can't remember at the moment. But creatine, there are a couple different forms of this one too. So creatine monohydrate is the one that we've always thought of for people who are bodybuilders trying to increase their muscle mass. Creatine hydrochloride has been researched a lot and kind of came about by accident at first, but it really has shown benefit for headache prevention, for brain injury healing, for menopausal issues with women. So there's lots of different uses for it, but creatine is kind of my latest, one of my favorites, because it's really can kind of decrease the brain fog and make you feel just overall better. So that's my list of supplements that I tend to kind of talk about a lot in clinic. And then other treatments we can do for headache. A lot of times people get referred to physical therapy. Why? Because we have a lot of tension in our neck and our traps, those big muscles on the back of our shoulders. And when we have a lot of tension there, that's going to lead to a lot of headaches. So a lot of the physical therapy exercises are focused on trying to release that tension, relax that tension. They can do things like dry needling, use ultrasound or TENS machines. Acupuncture can also be helpful for that, biofeedback to release that tension as well. A lot of different things there that can be beneficial for trying to decrease those headaches. There are some over-the-counter treatments that we can do. Initially, ibuprofen, acetaminophen, Excedrin, any of those can be really helpful for headaches. Excedrin is actually one of the number ones for post-concussion headache. And then the triptan medications, the Imitrex, the Relpax, Maxalt type of medications of the world. We use those for migraines on a regular basis. So if what you're having after a concussion is truly a migraine, those medications might help you, but you can only take 9 a month. That's as many as your insurance company will dispense for you, because if you take it too much, we can start having problems with now you have to take it in order to prevent those headaches. If you start needing more than 9 a month, if you have more headache days that you can treat, that's when we start looking at adding a preventive medication, whether it's a migraine or a post-concussion headache. Preventive medications, if the vitamins haven't worked, if those supplements haven't worked, if we can't break it with these triptan medications, then that abortive medication, or the preventive medication, will be the next line of medications that we choose from. And there are several different medications, and we always tailor it to the person because there are several different classes. We typically start with the first class that we think is going to benefit that patient the most. And then if that doesn't work, we go to another one. Unfortunately, there's not a test that tells us which one of the medications is going to work for every person. It's not like the genetic testing that we now have for the antidepressants, because these are not the same. Antidepressants is one class that we use, but it's not the only one. So there's no magic test that can tell us what medication is going to help every person. So it is a little bit of a trial and error, unfortunately. And sometimes people say they feel like a guinea pig, but we do sometimes have to try things until we find out what works for you, because everybody responds to medications differently. And then Botox injections would be kind of our last string. So if we have tried everything else and we still can't get control of those headaches, post-concussive or migraine, Botox can be helpful to relax the tension in the head, the face, the neck, so that we can try to decrease some of those headaches. So a lot to cover on the migraine topic, but we'll be done for that one for right now, because again, I'm pretty sure I talked about some of that in previous shows, but it's always a good reminder. The next term that I want to talk about is memory. And memory is probably the next biggest common concern that patients have when they come into the clinic to see me after a concussion. The short-term memory loss being the biggest concern that they have. Usually that short-term is affected more often than long-term, but sometimes people can have long-term effects as well. What does this short-term memory look like? So if somebody has short-term memory loss after a brain injury, it can be forgetting important details in a conversation. It can be forgetting where you left things. I know I set my keys down somewhere, but where are they? That's an overlap that we see with memory loss for lots of different reasons, but just forgetting where you put something. Feeling unsure of what you did earlier today or yesterday or last week when somebody asked you, hey, what'd you do today? Or what'd you do yesterday? My youngest teenager at home, I'll ask him what he did today. I don't know, stuff. It's not that I don't know stuff thing. It's you genuinely cannot remember what you did this morning or yesterday or last week. I don't remember what I ate. I don't remember what I did. I don't remember who I talked to. Sometimes you tell people the same story over and over because you don't remember that you've told them that story already. So it can lead to that repetition of things. You can lose track of time. You can forget what day it is. So even if you wake up in the morning, you know you have a physical therapy and an occupational therapy appointment today. You get up, you shower, you have breakfast, and you can forget that you have those appointments today because you forgot already what day it was and that you have those appointments, even though you know you had them, you got your reminders, and you still forget. It happens. Being unable to retrace a route that you took earlier in the week. So maybe you're going to your physical therapy and you have to go to your physical therapy again. You've been there once already this week, but you still can't remember it. So you still have to pull it up on the map so that you can get to where you're going. Forgetting all or part of a movie that you watched or a story that you read. Very common one. In my household, it's kind of turned into a little bit of a running joke because I don't even remember that we watched certain movies after my head injury. And my kids and my husband are both, yeah, we watched this as a family, but I don't remember it. So that's a very common thing to have happen as well. Forgetting to keep appointments, saying you'll call or visit somebody and then forgetting to do so, forgetting that you even said that you were going to do it. Forgetting to pick people up at certain times. And that can be maybe your kids from school or your parents from the airport. Just you forget because you don't remember that you're supposed to do those things. And then sometimes it can actually be just forgetting those procedural activities, forgetting those things that you're doing on a regular basis. How to wash the dishes, how to cook something. It might be a recipe that you have cooked a million times and you don't even need to look at the recipe for it anymore. But you stand there and you look at your ingredients and you can't remember what you're doing and you can't remember what you need to do next. So any of those can show up with that short-term memory loss after a brain injury. Long-term memory loss. This can look like you might recognize somebody but not remember their name. Maybe you'll remember it later, but not remember that name. Or other things that you just can't remember, like places you worked with, people you worked with, things like that. And then there's another thing called post-traumatic amnesia. So this is a period of time where an individual can't recall events that are happening or they can't form new memories. So after an injury, one of the questions we ask when we have somebody in for a concussion evaluation is, did you have any loss of memory from before or after the event? That loss of memory beforehand is called retrograde. Loss afterward is antegrade. I think I might be missing those two up right at the moment. But when we have that loss of memory, it becomes difficult to form those new memories. So you have things happen, and maybe you can remember what you did the week before the accident, but now as days go by, you can't remember what you're doing from day to day because you cannot form those new memories. So what do we do for management of memory things? Again, number one here is sleep. We talked about it with headaches. We're going to talk about it with memory as well because sleep is very important. Again, I think I've talked about this before, but if you've seen the movie Inside Out, at night when they pull that lever and they file all those marbles from the day, you've got your short term, your long term, and the ones that get discarded because they're deemed not important. That's really kind of what happens in our brain in a very simplistic version of that. And when you're not getting good sleep, especially when you're not getting into the REM sleep, you're not formulating those long-term memories. Things need to get filed in order for them to stay. So if you're not sleeping well, you're not sleeping enough, you're not going to turn all of those little short-term things that you had from memory from today into long-term memories. So you need the sleep so that your memory can actually work better. Emotional support. If you are stressed, and we just talked about stress, right? Stress happens to everyone. If you're stressed and you're not coping with it, you're not getting the support that you need, that will cause more issues with your memory. And then having more issues with your memory will cause more issues with stress. So we get in this downward spiral. So it's really important to try to stop that spiral and get the emotional support so that you're not feeling quite as stressed, and you can stop and you can think clear and you can remember things better. So along that line, again, is the stress management. There are some little tips and tricks for trying to retrain your brain. So there are two main ways that our brain heals. One, by either those cells picking back up their job that they had before, or two, by compensation. We learn to do things differently so that we can do the same things we did before, but we do them in a different way. So sometimes it now requires you to take notes. I was never a note kind of person before my injury. I could remember everything. I was one of those really annoying people that I remembered things really, really well. And I didn't have to write things down to remember them. And now if I don't write them down, they don't happen because I don't remember them. So I take notes on everything now. So writing things down is that first little trick to try to help retrain your brain. And write down even the simple things. So if you're making lists, and lists are great. I always used to love being a list person when I was cleaning. So when I did my to-do list for the week or the day or whatever I had to do, I loved that list because I could check things off and I felt so satisfied by completing things on that list. And now that list looks a little bit different because sometimes you have to be a little bit more explicit in that list. You might need to break down the steps of something that you need to do. So rather than just put laundry on your list, you might need to put wash the laundry, dry the laundry, fold the laundry, put it away, put the basket back down in the laundry room. You might have to put down the steps until that becomes your natural norm again, because somewhere in there you might forget some of those steps. Just had a conversation with somebody yesterday, just trying to help him remember the things that he was doing at work, because he's back to work after an injury, but wasn't always remembering every step. So we talked about writing down those things that he does on a regular basis to make sure that he doesn't miss anything, and just kind of scanning through that list again, double checking that he's done everything that he needs to do. So really great tip on that one. Set reminders. We all have phones in our pockets these days, and they all have calendars on them, and they all have reminders on those calendars. So when you put an activity on your calendar, I highly recommend putting an alarm on it. Shortly after my injury, when I was going to all my physical therapy, occupational therapy, at first I would put the event on the calendar and I would forget that I needed to put an alarm. But it didn't set the alarm automatically. And I would miss appointments or almost miss appointments because I'd look at my calendar at the last minute and be like, oh, shoot, I got to get there now. And I might get there a few minutes late. But if you set that reminder alarm on there, you can set it for whatever time frame that you need to. If you have a half-hour drive, set it for at least a half an hour before the event so that you don't miss it. But you can set those reminders so that you don't miss those events. And maybe that's not something you needed to do before, but maybe it's something you need to do now. And then break up those complex tasks like I mentioned. So step by step, take breaks before you need them. And that was one thing that my OT and PT kept telling me for the longest time, was to take breaks before I needed them. Because if I didn't, then I needed a longer break, or I would hit my wall and I couldn't do anything more that day whatsoever. So if you take breaks before you need them, that actually gives you longer time that you can go without having a little bit more worse consequence on that one. And then don't try to do too many things at the same time. Again, I was talking about this with someone yesterday as well. And I half joke that I couldn't multitask after my injury because tasking was difficult in itself, just doing one task. So if you have to do multiple things, you're not going to multitask as well. Research has shown us time and time again that when people try to multitask, we're actually not as efficient as if we were doing one task at a time and giving our true focus to that one task. And yet many of us still try to say, well, I'm really good at multitasking. Maybe not, but after a brain injury, you're probably definitely not good at it. So instead, try to do one thing at a time. And that was really, it was and is still difficult for me because I really like to try to multitask. But I have learned too that especially if my kids come up and they try to talk to me, if I'm doing anything else, I'm not going to remember that conversation as well. And if I stop and I look at them and I give them my full attention, multiple things are happening there. Multiple things. I was going to say two, but it's probably more than two. One, you're showing that child respect. You're showing them that their time is valuable and you want to pay attention to them. Two, you are taking your ability to get distracted away. So you're looking at them, you're listening to them. The chance of you remembering that conversation goes up because you're looking and you're paying attention to them. And then it just kind of, again, sets that pattern for them. If they see you constantly, continually doing something else and not paying attention to them, they're probably going to kind of mimic that activity as well. So you're setting that guideline that this is the expectation, is that you pay attention to somebody. So lots of really good things that can be happening just because you have to do that now. And then finding workarounds to do things successfully. So any kind of little trick or tip or note that you can leave yourself, or reminder that you can leave yourself, or something that helps you be more successful in that activity, the better you're going to be and the less you're going to forget things. So that leads into the next M letter, which is mood. And mood is very closely correlated with our headaches, with the migraines, and with our memory. Because if our memory is not great and we're having a lot of migraines, our mood is going to be affected as well. It's very, very common to have mood changes and emotional dysregulation after a brain injury. It can range from mild to severe. It can persist for weeks or months or longer. And some of those common mood changes that we see include just irritability, for one. So just being a bit more irritable, or more than a bit more irritable. Having anxiety. Maybe you didn't even have anxiety before and now you do. Depression, emotional lability again. So if you are just on a roller coaster of emotions, you can cry easily, you can laugh easily, you can go from one to the other in a split second. That emotional lability also very common after a brain injury. People often describe it as having a short fuse, being easy to anger, because it really doesn't take much to set off the anger in a person after a brain injury. I can say that from personal experience because I'm a little bit more of a short fuse than I used to be. Why does this happen, you might ask? I always love the why. Damage to the brain cells and the neurotransmitters can cause changes in the mood. So our neurotransmitters, the acetylcholine, the norepinephrine, those transmitters in the brain that tell our brain what to do and transmit information, if they're not working appropriately, they're not going to tell our brain when we should be happy, when we should be sad, when we should regulate those emotions. So just the damage directly to the cells from the shearing forces, from the tearing forces during a concussion. The changes in the brain chemistry, so the hormonal imbalances. Those hormone imbalances, all those hormones help to regulate our emotion as well. So the hypothalamus creates our growth hormone, our sex hormones, all of these different endocrine hormones that if they are out of whack, it's going to affect our mood. Because then you think about when a female goes through her cycle, think about times when those hormones change. You get those emotional imbalances, right? Well, now you've got everybody in post TBI world they're kind of on their cycle. So we have a lot of emotional imbalances there. And then sleep disturbance. Here's that sleep again. We keep talking about it. If you're not sleeping well, it's going to affect your mood. So better sleep leads to better mood. Stress and anxiety, again, leads to more mood changes. And then we get in this downward spiral again. And we can develop these mood changes, or they can worsen because you get frustrated because you're not getting better. One of my biggest frustrations was seeing a provider and having her tell me that all of my issues were related to my mood. I'm like, well, I'm pretty sure if you were in my situation, you couldn't get back to work, you've had problems with your mood as well. I don't think the mood caused the symptoms. The symptoms were there present. They were present before the mood disturbance, but it was frustrating because I wasn't getting back to work and I wasn't getting better. So guess what? When I got back to work, a lot of those things went away because there was frustration from the situation. So we have to be careful not to jump on that bandwagon and say, well, it's all mood related, because it's not all mood related. Do people with concussions, head injuries, have a higher incidence of having mood changes? Yes. Do they have a higher incidence of anxiety and depression? Yes. But do anxiety and depression cause all of their symptoms? No. It can make them more unbearable and it can make them more difficult to deal with. And then again, we get in this downward spiral. How do we manage mood? Rest, cognitive behavioral therapy, medications like antidepressants and anxiety medications do play a role, support groups, lifestyle modification. We talked about all those things already, stress reduction, and giving yourself grace. That's kind of the biggest one, that one. Give yourself some grace because you are healing and you will be continually healing after this. So don't get down on yourself when you do get frustrated, because frustrations will come. You have to learn how to cope with it, how to work around it, and how to get through that frustration rather than letting it control you. We will talk more a little bit after the break to go through a couple more M letters. But here we are on Recharging the Human Battery at AM 950 Radio. All right, welcome back one last time here on Recharging the Human Battery on AM 950 Radio. Again, Dr. Sinacropi's been out today. It's been just me, Mandi Dickey, talking about the ABCs of concussion. We've been talking about the letter M today and covered some really good topics so far. I have so many more on this list that I thought I was going to get through all of them today, and I don't think I will. That's a first. I talked a little bit more than I thought I would on each one of these subjects. So I'm not going to get through my entire list that I intended today, but there are a couple more that I really want to get through because I think they're really, really important. One being multiple concussions, because this is one that's really kind of in the news a lot lately with the thought about CTE, that chronic traumatic encephalopathy that can happen when somebody's had multiple concussions. And there's another thing called second impact syndrome. So if you have a concussion, you return back to your activities and you don't seek treatment and you're not back to normal, you have another concussion, you can have something called second impact syndrome, which does not affect everybody, but it can happen. And it makes it really, really difficult to get back to your new normal. And for some people, it can cause some really bad damage in the brain that now is irreversible. So we really don't want anyone to have another injury while they're trying to recover from the first one. But if you're playing a sport, there are reasons why we have those rules about staying out of the sport until your symptoms are better. Because if you're not back to your baseline and you get another hit, you might not ever get back to that baseline. You will probably be setting a new baseline in your brain because your brain can't heal appropriately from multiple hits, especially when it couldn't heal from the one. So that second impact syndrome can be life-threatening for some people. Most often, these happen if the injury happens within days of each other. It can be a little bit longer, but mostly within days. And even if that second injury is mild, it doesn't have to be super, super big on it, but it still can be very detrimental. I have one patient who she had a really bad year last year. She got hit by deer. And I say hit by deer because deer jumped out in front of her on the road twice in a week. Totaled her car with the second one, but she had significant symptoms because she had these back-to-back injuries in a matter of a week. And we really have had a tough time trying to rein in on her symptoms with that. And most often we see these with high impact sports, but again, it can be multiple car accidents, multiple non-high impact sports. And then that diagnosis is really challenging because the symptoms overlap and we can't really be sure, well, is this the first concussion? Are you having another concussion? But it really it's a very clinical judgment then at that point. And again, according to some of the research that's out there, when we talk about somebody with a second impact syndrome, there are some research articles that will say that 50% of people will not survive this and 100% of people are permanently impaired. So that's pretty significant numbers when you're looking at this. So it's really, really important that we try to decrease that risk of having a second concussion. And again, if we have those multiple concussions, it does put us at risk for the CTE, that chronic traumatic encephalopathy. I did talk about that back on the letter C, so I'll let that episode kind of speak for itself on that one. But it's very big on the news right now because NFL players have had it. There was a study that published last year that said that when they looked at these former NFL players, you can't really diagnose CTE until autopsy. But 90% of the patients in this study, 90% of those former NFL players had symptoms consistent with CTE. And that's huge. And on my personal podcast, Brain Wellness, the podcast, I interviewed an Olympic bobsledder, and that's going to come out next week on my show on the Brain Wellness podcast. And he talked about that risk of CTE with bobsledding. And I don't think we even have really addressed all the sports that can cause concussion and can cause these multiple head injuries to happen. You guys, I was going to talk about military and menopause, and there's so much more on that. I will kind of reserve those because I haven't, we don't have the time to cover those today, but There's been so many topics to cover. And again, if you've had a concussion, you don't understand why you're still having the symptoms, maybe we answered some of those today. If you have these symptoms and you don't know why, look back and see maybe you had an injury that could have caused a concussion. And if you're a provider trying to figure out how to help people, maybe I gave you some good tips on that today too. So thanks for being here. Try not to hit your head. Walk like a penguin on the ice. Take care of yourselves, guys. Here we are, ending up on Recharging the Human Battery, AM 950 radio.